I have a question more towards the software component in the healthcare arena, because there are many times I dream up a cool idea at night for a new app, and then when I wake up, there's already an app developed for that. So just looking into the healthcare arena between cardiology, radiology, OR integration, inventory control, sterile processing, instrument tracking, even patient entertainment, medication processing. There's so many softwares written, and vendors are becoming smart at developing their proprietary technology and software platform to give you a more intelligent management capability. But on the responsibility shifting topic, as the owner and healthcare providers, you're now more obligated in terms of managing and adapting to those different software platforms, and especially managing these databases to make sure everybody's looking at the same file, most up-to-date information. So I wanted to ask, what's your current experience on managing and planning the software implementation of that aspect? And also, where do you see the future of this going? And talking about how we can influence the industry, even in terms of managing systems, you'll need a software for that. So just curious on your thought on that.
You described a huge problem. The magnitude of all the data we're gathering more data every day. And what do we do with that data? We want to be sure the right data gets to the right people. There are a lot of silos. You've heard again and again here, black box, one system not considering another system. So in the most cohesive environment, everything would know about everything. I think the board did that on Star Trek. We're not there yet. We have huge challenges between just a sterile processing system and a surgery inventory system. They're 3 floors apart. They work on the same patients constantly, and we have huge challenges trying to coordinate that information and make it correct for the care of the patient. I think it's an initiative, and I think it's been a theme we've heard all morning, is we need to talk more about when we introduce systems, how do they impact other systems? The lowest common denominator I know right now that is really giving any effect is literally buying all your systems from the same vendor seems to help. I hate to say that because I've always been kind of a best of breed proponent. We interface these systems, but it's tough. I know there's some folks who've had some real wins with some systems. Healthcare's kind of lagged behind in the technology business, and I think we all know that, particularly compared to finance and manufacturing and things like that. I think we're finally beginning to catch up, and I think you'll see some of the big providers out there who make a number of modules or leveraging the combination of those systems. But it's a big hurdle, and it's got to be a concentrated effort. That what I would call enterprise architecture is the process of making smart decisions. You don't make them at a department level, you don't make them at a division level, you make them at an enterprise level. You need to know what every company does, what they want to do, and particularly what they're buying. So everything's a decision point, whether you're buying a system, retiring a system, or combining a system. If you can maximize the intellectual value you have there at the decision points and make great decisions, that's going to lead you down the road as best you possibly can be. But even if the best possible decision today is not going to get you to Nirvana, because the systems just aren't that integrated, nor are they that easy to integrate together if they're disparate systems. So you just have to focus on it. And but for the IT department, I think that's a focus we've had. It's really becomes a governance process at the administration level of the organization. It's not an IT problem necessarily. It's a governance problem from the organization. What are these different companies, departments, divisions doing? What are they trying to achieve? And how are we going to care for the patient at the end of the day and be sure we get the right data at the right place?
I would also suggest that there are some foundational elements that most of us assume exist, but they don't. If you look at any one facility, where's your master directory? How do I know what your phone is? How do I know if you're working on a nursing unit? How do I know your credentials? You're badging in and out of areas. I'm betting you're security has its own database. Your applications have their own database. These new communication tools that we're introducing, some of them have their own databases. So if you can begin to look at those foundational elements that we really need for pervasive communication and driving forward with those discussions. We have a visioning session tomorrow morning at 9 with our medical staff, our security system vendor, our iPhone vendor who happens to be in the back, and 4 or 5 other applications that are out there that we don't have common directories. I can't deliver pervasive communication if I can't find a physician. And once again, I think that there's an assumption that those very basic elements are there. So we're focusing on the very sophisticated integration without realizing that we can't be completely successful until we get the baseline.
This is part of the 80,001 concept, is building the governance and, if you will, system inventory that is kept live, up to date, and reflecting who in the organization is doing what with the software.